Right, I think I can start now and everybody can join whenever they can. We have quite a few people here already. Yeah. Yep. Right, I'll share my document now. We can see this one, right? Okay, great. So fatty liver disease. Last time we were here, I think most of you asked me to do fatty liver. Because we drifted in that direction after talking about cholesterol. We sort of decided to uh, you know uh, go in a tangent, I think, almost, and you started to discuss fatty liver. So I thought, okay, let's do fatty liver this time. Yeah. So this is the fatty liver disease topic. I'll just get my documents right here and then we can do that. Here we go. Okay, this is the document we're sharing. Okay, somebody else is here as well.
Hello, good evening.
Hey, good evening. How are you?
I am good, thanks. Thank you. Sorry about joining late. I could not
That's okay.
find
We
the
haven't started yet. We're just about to get the topic ready here. Okay, so okay, let's do this now. All set. Everybody's here. So we're discussing fatty liver disease. Last time we discussed cholesterol management and the risk factors and so on. And therefore, I remember we almost switched to fatty liver towards the end of our session because I think some of you asked me questions about fatty liver, right? So, fatty liver disease, again, is becoming and more prominent because we are noticing that people are suffering from fatty liver due to the lifestyle factors, due to the complex health issues we have, and there is always more than one thing prevalent. So it's not only the cholesterol, there's always something else going on in the background, like insulin resistance and weight management, truncal fat, and then the fatty liver comes into picture because they're all so intertwined and interlinked together. So, fatty liver is one of the most common conditions worldwide, and it occurs when excess fat accumulates in the liver cells. Uh, while small amount of fat in the liver is quite normal, but excessive fat would lead to inflammation, scarring, and eventually the liver failure if it's left untreated. So the encouraging news is that fatty liver disease is often reversible, especially when we detect it early, and if we manage it through the lifestyle changes. So we can reverse this problem. What is fatty liver? Fatty liver disease refers to the accumulation of fat in more than 5% of the liver cells. And there are some types of fatty liver. Basically, what causes fatty liver are the non-alcoholic causes. So the non-alcoholic fatty liver disease, which occurs in people who drink little or no alcohol. And recently, experts have started using this term more. It's called non-alcoholic fatty liver disease because it's become so prominent that it's almost taken over the alcoholic fatty liver. And therefore, we are talking more and more about non-alcoholic causes of the fatty liver. This one is the most prominent category here, which is metabolic dysfunction associated fatty liver. And this is the most important one. You know why? Because this is what I deal with day in, day out, which is not the alcohol one, not the complex liver problems, but this is the one which happens because of the lifestyle. So metabolic dysfunction associated steatotic liver disease. This newer term emphasizes the strong association with metabolic conditions such as obesity, diabetes, insulin resistance. So that's my bread and butter. This is what I deal with day in, day out, right? And that's where the preventative part comes in as well, because these are the things which we can prevent, modify, deal with sort of in a certain way. Then you have alcohol-related liver disease, where you have fat accumulation caused primarily by excessive alcohol consumption. And again, we're not going to get into this one. So this is the one we want to discuss, which is called MASLD, metabolic dysfunction associated steatotic. Steatotic means it's the fat, basically, liver disease. The physiology of liver disease, fatty liver disease. The liver plays a central role in fat metabolism and the cholesterol production and glucose regulation, detoxification, and protein synthesis. So this is the role of the liver, which we have discussed even in our last discussion. Remember, we went through a lot of details about how the cholesterol production works and what all happens here. So once again, the liver has a central role in fat metabolism, cholesterol production, glucose regulation, and detoxification, and protein synthesis. So major organ liver is. Under normal circumstances, the liver receives fatty acids from the food and body fat stores. So what liver does, it will receive the fatty acid from the food and the body fat stores, and they will burn some of it to produce the energy. And the other role, remember we talked about lipoproteins, so it will package the fat into these lipoproteins, and then lipoprotein will travel in the form of LDL, VLDL, and all that. So please remember the crucial role of liver in those three areas. That means basically it receives the fatty acids from the food and body fat, then will burn the fat for energy, and it will package it into lipoprotein, right? Now, fatty liver will happen when fat delivery exceeds the liver's ability to burn or export the fat. So when you have kind of too much fat on the liver, it can't do its function as it was doing before, because you have a lot of liver has a capacity like any organ does. So when it's overwhelmed, it will say, okay, you know what, this is what I can do, and I can't go any over and above this. I'm tired. I've had enough. So that scenario comes here as well when we have too much fat on the liver. So normal actions of insulin on fat metabolism. Now, insulin plays a major role in this whole fatty liver business. Insulin is the body's major anabolic hormone, or we call it storage hormone. So when we talk about insulin, we remember, okay, it reduces your sugar level, and that's the main function. But we know that there's more than that to understand here, that it's the major anabolic hormone or a storage hormone, and its primary role is in fat metabolism, is to promote the fat storage, and it prevent the fat breakdown where energy is abundant. So it will promote the storage of the fat. That's what insulin does, and will prevent the fat breakdown where you have enough energy. Please remember this. It's extremely important thing to remember, that what insulin does is going to prevent the breakdown of the fat and will promote the storage of the fat. Okay, when there's enough energy. So when there is enough energy, we don't need to break down the fat. When there is no energy, let's say a bear who doesn't get food, in the winter months, he gets into hibernation and he has got lots and lots of fat he's going to burn and live for next 6 months, even if without food. But that's not how human body works. So, but that's the role of insulin, that it will promote the fat storage. So if you so for example, if you go in that situation where you become a bear and you have no food, and for many months in the cold winter months, it will burn that fat and give you the fat, right? So, but right now, it's just keeping that store. That's what insulin is doing. Insulin promotes the fat storage in the tissues. After a meal, the insulin will go up and it will stimulate the glucose uptake into fat cells. It will convert the excessive glucose into fatty acids. It will combine fatty acid with glycerol to form triglyceride and will store triglyceride in the tissues. So please remember this, that what does insulin do? It will stimulate glucose uptake into the fat cell. That will convert the excessive glucose. So we use the glucose that we need for energy. We utilize it. Whatever is extra will change into fatty acid, will store in the tissue. And then what combines fatty acid with glycerol to form triglyceride. And triglyceride is the storage form of the fat. So insulin is just telling the fat that, hey, we don't need you. Just stay there in the tissue. Don't break down. Just, hide in a corner. Don't bother me. And now, next thing it will do, it will prevent the breakdown of the fat. So fat cell will contain an enzyme called hormone-sensitive lipase, HSL. Now, insulin will suppress the HSL, which reduces the breakdown of triglycerides. So it's, again, as I said, it's an anabolic hormone. It's just preserving things. It's not causing the breakdowns. Now, insulin suppresses HSL, which reduces the breakdown of triglyceride. It decreases the release of free fatty acid into the bloodstream, right? So what's insulin doing? It's not letting the breakdown happen of triglyceride, which is the storage form of fat, and it decreases the release of free fatty acid into the bloodstream. Because remember what this free fatty acid will do, it will go to the liver, right? And insulin is telling that, let's not do that. Don't put our liver, my friend, into strain. Let it be, manage things that it can for the time being. Reduces the third function of insulin. It reduces the free fatty acid delivery to the liver. So it's preventing the overloading of the liver. That's what insulin is doing. So now we know insulin isn't just a hormone for sugar control. It's a very important hormone that also is managing the fat and not letting this free fat to go to the liver. It's just keeping it under the storage form. Yep. Another function of insulin, it stimulates the fat production in the liver. It activates the pathway that will convert extra carb into fat, which is called lipogenesis. It happens through some of these factors. We don't need to get into that. The liver converts glucose, fructose, excessive calories into the triglyceride, which is a storage form of fat, right? Now, what happens once there's an insulin resistance? Insulin resistance is a terminology that we use a lot, that our insulin in the body doesn't work the way it wants. And that's when a lot of complex situations arise. That means there'll be a lot of fatty acid, there'll be increased fat production, and there'll be reduced fat burning, and there'll be increased triglyceride accumulation. So all those things that insulin was trying to manage will go haywire. And you'll have free fatty acid, you have fat on the liver, you'll have reduced fat burning, increased triglyceride. All the fat would be there heading towards liver, right? Why does insulin resistance happen? It's more so to do with the metabolic reasons again, that our body doesn't recognize the insulin as well due to the receptor changes, the metabolic changes, obesity, and all those things. Over time, what happens, there's fat accumulation on the liver, then there's inflammation, then there's fibrosis and cirrhosis. these are the 4 stages of liver problems. So this fat will be there too much, then there'll be inflammation, then fibrosis and cirrhosis. And this is a very complicated picture here. I put it together in case somebody wants to decipher it later in your own time with the information that we have here. But basically, it's talking about how things go through stages. That means too much liver, then there's stress to the liver, then there's inflammation to the in the liver, and then there's more insulin resistance, and there is fibrous tissue formation in the liver, which would be liver failure stage or fibrosis stage or cirrhosis stage. So even the fatty liver would lead to this stage, which is the advanced liver failure stage, which is fibrosis and cirrhosis. So we are taking this more seriously now than we did before. So we need to keep that in mind that, you know, our liver is kind of under stress when all these situations arise. And when we put liver through too much strain, it would even lead to the failure of the liver because liver is not coping. Now, what are the risk factors? Metabolic risk factors are obesity, insulin resistance, type 2 diabetes, high triglyceride, low HDL, and diet high in sugar and processed food, and physical inactivity. So all these things on this left side of the picture here, what are they doing? They're putting liver under strain, right? They're causing accumulation of fat on the liver and putting liver through all these stages of stress. So what leads to, what are these? The obesity, insulin resistant, type 2 diabetes. Remember, less good fat, less good cholesterol, and diet high in sugar and processed food and physical inactivity. So they're all metabolic factor. Then it causes the accumulation of fat on the liver in that picture, the second one, and increased fat delivery to the liver, increased fat production by the liver, because the liver will convert excessive sugar, fructose, and carb into triglycerides. So poor liver is struggling in all directions because there's too much fat coming through, and there's too much sugar there, which is also going to be transferred into fat. Reduced fat burning is going to happen because normally the liver will burn fat through the beta oxidation process. In fatty liver, that mitochondria is our, you must have heard, it's a powerhouse of energy, powerhouse in our cell called mitochondria structure, which would deal with some of this as well. And because the mitochondria doesn't work very well, there'd be less fat that would be burned and there'd be more fat accumulation. Fourth stage, there will be reduced fat export. The liver normally packages this triglyceride into VLDL particles and we export them. In fatty liver, the VLDL secretion becomes inadequate and fat remains in the trap cells. So in all these mechanisms are happening here, which is causing this picture. That means too much fat on the liver. Liver is not coping well. It's all that extra sugar is changing to fit to the fat, and liver is not able to make these VLDL particles which were going out, out of the liver, and everything accumulates on the liver. So our liver, which is nice and clean structure here in the top on the right hand corner, starts to become more unhealthy as the time goes on. It goes through different stages. If you look at the right side of this picture, it will go from being fatty to hepatitis, which is inflammation, to fibrosis, which is scarring, and so on. So even metabolic health condition cause liver failure, we know that. Now progression, not everyone with fatty liver will develop severe liver disease. It's called multiple hit theory. So stage 1, there'll be fat accumulation, little or no inflammation. Stage 2, it used to be called NASH. People are more familiar with the word non-alcoholic steatotic hepatitis, but now we call it MASH, which is more metabolic. And fat will accumulate here. There'll be inflammation in stage 2. So stage 1 is just fat. 2 is inflammation and hepatitis. There will be liver cell injury and enzymes will go up. Liver 3 is fibrosis. And liver 4 is cirrhosis, which is the irreversible damage that has happened, right? So it goes through all these 4 stages, and cirrhosis is quite bad condition. It actually is irreversible, very poor prognosis, and people have lots of problems when they have liver cirrhosis. Stage 5 is hepatocellular cancer, which is after the cirrhosis, it could lead to the cancer. Now we talked about the key mechanism for how this is all happening, that our liver is overloaded, there's lipid toxicity, and certain fat molecules like ceramide and DHA are toxic to the liver cells, and these toxic fats will cause stress to the liver and injury, and there's oxidative stress that happens, and it will damage the DNA protein cell membrane. And then ER stress, which is again a cell level change, is called endoplasmic reticulum stress. The excessive fat will disrupt this process. Sorry, I keep going back here, which I don't like. Sorry, it goes back. So this different stages of stress to the liver we're talking about here. So the changes will happen at the DNA level and the cell membrane level and so on. Inflammation would be caused by the inflammation markers like tumor necrosis factor and interleukins. They will cause damage to the liver. So our body will, immune response of our body will just kick in, and it will instigate a inflammation process, which would cause liver injury. Fibrogenesis, activated hepatic stellate cells produce collagen. So then the fibrous process will start. Too much inflammation happens, and then comes the process where the scarring starts to happen, which is fibrogenesis. So you have the hepatic cells, they will produce collagen and matrix, and that will cause the problem again, will cause the fibrous tissue. Clinical outcome, it depends. Patient can get tiredness, high liver enzyme, liver will be enlarged, fat will be seen on an ultrasound scan, and fibrosis on the scans. Now, these are all the risk factors, which is obesity, type 2 diabetes, pre-diabetes, and unhealthy fat. Excuse me. Dietary causes, too much sugar, soft drinks, sweetened juices, candies, dessert, processed foods. We know this. Fructose is especially associated with liver fat accumulation. Fructose is cannot highlight enough. So sugary drinks or sugary foods, candies and all, added sugar, refined sugar, they will lead to the excess fat. Refined carbs, again, also a contributing factor. Other causes are these, like polycystic ovaries, sleep apnea, hypothyroidism. They will slow down the metabolism, and rapid weight gain, genetic predisposition. So these are certain factors which are not metabolic, but they are indirectly metabolic, because polycystic ovary actually causes insulin resistance. So does the low thyroid. It causes slow metabolism. So they are indirectly affecting that too. Symptoms: fatigue, low energy, sometimes right upper abdominal pain, brain fog, feeling unwell. That all sometimes happens. Simple status. So understanding fatty liver. Stage 1 is just simple fatty liver, just the fat. Second stage is where there's some hepatitis or inflammation happening. Third stage is the fibrous tissue. Fourth is the cirrhosis, which is the extensive scarring, structural damage, and increased risk of liver failure. Fatty liver grading on ultrasounds: grade 1, mild; grade 2, moderate; 3, severe. They're the grades. Liver enzymes in fatty liver. The most commonly measured liver enzymes are ALT, AST, ALP, and gamma GT. These are the liver enzyme I check when we do the liver function on a regular basis. So here, ALT indicates liver cell injury. AST indicates liver injury again. ALP is more related to the bile duct. So somebody who has a gallstones and they have a blockage of the bile duct, they get rise in ALP, but it can happen in fatty liver. Gamma GT is related to alcohol-related injury, and sometimes it also indicates the liver injury. Normal liver enzyme doesn't mean you don't have fatty liver. Now, this is where the challenge comes, that how do I know that you have a fatty liver without having a normal enzyme? But it does happen that many patients with advanced fibrosis, they have a normal liver function, which is interesting. That's where the challenge comes. But often what happens, these patients will go to the ultrasound department for some other scan, and the radiographer will say, hey, you know what? You send him for uterine scan, but the liver looks fatty, and then we look into it. Fibrosis is the strongest predictor of the outcome. Patients with advanced fibrosis have increased risk of all these conditions. FIB-4 score is a simple fibrosis screening tool using age, AST, ALT, and platelet count. So FIB-4 is a score that we use for some of these things to predict the risk of fibrosis. That means how bad is your fatty liver. So if it's less than 1.3, then it's low risk. 1.3 to 2.6, intermediate, and it's a calculation you do with the FIB score, FIB-4. So I wouldn't worry you too much about, for you guys, just know there's something called that. You don't need to know exactly how we do that and all that. Leave that for us. FibroScan is a test that's available to us, and it predicts the severity of the fatty liver, and it also tells us that how bad the liver condition is by doing the scan. So it reflects fibrosis and scarring, and CAP score, it reflects the fat accumulation. The test is non-invasive, painless, and takes about 10 minutes to do. So the FibroScan is easily available nowadays. And when somebody has prominent fatty liver, I do arrange a FibroScan just to see that is this just the fatty liver, or it's progressed to the fibrosis stage? Remember the stage 3 or stage 4? And what is the CAP score? This is another score which tells us how much is the fat accumulation, what is the exact grading of the fatty liver. It takes about 10 minutes. So this is the FibroScan. These are the stages. So the building next door where I work, they do FibroScan. 5 Fairview Mall, they do FibroScans too. Higher stiffness value means more fibrosis. Complication of fatty liver disease, fibrosis, cirrhosis, liver failure, portal hypertension, liver cancer. Cardiovascular complication. So the leading cause of death in patients who have fatty liver is not the fatty liver, it's the heart disease. Because what happens, patients have higher risk of heart attack, stroke, and hypertension. That means by the time your liver is fatty and accumulated fat, your heart arteries are blocked anyway. So you're not going to die from fatty liver. It's more likely the death is more likely to be caused by heart attack, stroke, or maybe even blood pressure. Metabolic complications are all these: sleep apnea, kidney disease, type 2 diabetes. How does type 2 diabetes? So, when you have too much fat on the pancreas doesn't do the job properly, and it's responsible for releasing insulin and so on. So it's the fat on different organs. Can fatty liver be reversed? Yes, it can be, especially in early stages. So that's where the whole focus has to be. I know I've spent so much time going through the process and the pathophysiology, because I want you to have that understanding of why this is happening and how to set the foundation right. But what our focus is this on, to make sure that we can reverse it. So in early stages, you can. It can be reversed. It shows that 5% weight loss can reduce the liver fat significantly. That's awesome, isn't it? 5% weight loss is what? 5 kgs in a 50 kilogram person, right? So that's good. It can be done, or less than that, isn't it? Yeah. So 7 to 10% weight loss. Then again, it can improve the inflammation, 10% or greater weight loss. It can improve fibrosis, and sometimes it will reverse the non-alcoholic fatty liver. So this is useful. Weight loss is the key. I think it works for everything. It works for controlling blood pressure as well. But 5% weight loss will reduce the fat, 7 to 10% reduce swelling, 10% or more would reduce your chances of getting fibrosis. So treatment of fatty liver disease, of weight loss. So remember, not easy to do, but can be done. As long as we know this is in the pipeline, it's going to get worse, we start working on it early. Avoid crash dieting because that puts strain on the liver. Just do it in a more slow process, in a healthy way. Exercise, of course, helps. Resistance training helps a lot because what with resistance training, what happens when you have strong muscles, your energy gets consumed well. Your fat and energy will be accumulated in the muscle, and therefore remember everything was going to the fat to the liver. That can be stopped by increasing your muscle strength. So more the muscle, the better the metabolism, the more the sugar is going to be consumed and utilized. So resistance training which is good. Control the blood sugar for patient with diabetes, improve HbA1c and reduce insulin resistance. Improve cholesterol and triglyceride. Remember, we talked about healthy and unhealthy cholesterol and how it works. So we have to focus on reducing the triglycerides, reduce ApoB containing particle, improve HDL. We know all this. Then we have medication routes. So lifestyle modification remains the cornerstone of treatment, but there are drugs out there which have been tried and tested for fatty liver. But pretty much these are all diabetes drugs. Trust me, GLP-1, it's a diabetes drug. Semaglutide is diabetes. Tirzepatide is diabetes medication. You know, the weight loss drugs, we have all these drugs, GLP-1s, semaglutide, tirzepatide. These are all weight loss medications. So in a way, once you reduce the weight, whether you do it through diet or drug route, it's going to help. The best diet for fatty liver is Mediterranean diet. We know this. Mediterranean diet is good for everything, reducing the cardiovascular risk, reducing the Mediterranean fatty liver, and it's the most healthy diet available. So we're doing more vegetables, more fruits, more legumes, more nuts, olive oil, fish, lean protein, and whole grains. We know this already. And we know that these are all the no's, right? We don't want the fructose, high fructose. So these are all the no's. Food that help fatty liver. This is the list: salmon, sardine, mackerel, avocados, walnuts, almonds, lentils, chickpeas, Greek yogurt, coffee. They all will help with the fatty liver. Please remember this. All these foods. And I think these are, again, Mediterranean diet, right? Very basic Mediterranean diet, which we can easily incorporate in our diet. Coffee, it says 2 to 3 cups daily if it helps fatty liver, mainly black coffee, that is. So it's interesting. I can't have coffee. My body doesn't like coffee, but yeah, for somebody who likes it, why not? Coffee consumption has consistently been associated with lower fibrosis risk. That's interesting. So the takeaway is that fatty liver disease is primarily driven by insulin resistance and metabolic function. Many people have no symptoms despite the disease. Normal liver enzyme doesn't mean there's no fatty liver. There could still be fatty liver. FIB4 and FibroScan are helpful. Weight loss, exercise, Mediterranean diet. Early stages, it's reversible. We can change things around. Fatty liver disease is not just a liver condition, it is a metabolic health condition. So addressing the weight, diet, insulin resistance, physical activity is going to help. These are some of the evidence we have. So key evidence and landmark studies in fatty liver disease. Weight loss is the most effective treatment. We just talked about it, right? Mediterranean diet certainly helps. We discussed that, the proven studies, coffee and liver protection, there's some work on that. Diabetes, obesity, and fatty liver. Approximately 60 to 70% of people with type 2 diabetes have fatty liver. Remember that. So controlling sugar and so on. Obesity is one of the strongest risk factor. Visceral fat is most commonly strongly associated with liver disease than overall body fat. So evidence for FibroScan and FIB4. FIB4 is now recommended as the first-line screening tool in many guidelines. A study of 576 biopsy-proven patients showed that low FIB4 score had a very high negative predictive value. That means approximately 98% for excluding the fibrosis. That means if you don't have access to the scans, you will do the calculations and calculate the FIB4 score, which is based on, remember, the platelet count and those liver enzymes. We are lucky, we are in Toronto, I have access to fibro scans. We're very lucky, so I just scan it if we feel there's a need for it. Meta-analysis involving over 1,000 patients found FIB4 to be one of the best non-invasive fibrosis assessment tools. FibroScans are these, it's non-invasive, it's easily available. In my nearby area, we've got 2 clinics that offer it, 5 Fairview Mall and 240 Duncan Mill Road. It can estimate liver fat. I would only do this for somebody who has a prominent fatty liver or the liver enzymes are high. I will do that, certainly. So GLP-1 medication is the drug we use for weight loss nowadays. You know, the magic weight loss drugs we have, Ozempic and Wegovy. There is emerging evidence that will reduce the fatty liver. How it's going to do it? It's basically reduce your fat. So when you lose the fat, you reduce fatty liver. Tirzepatide is another injectable weight loss drug and diabetes drug. Why cardiovascular disease matters the most? Because most patients with fatty liver are more likely to die from cardiovascular or heart-related than from liver. This is why treatment should focus not only on the liver, but also on blood pressure, sugar, cholesterol, and all that. Practical evidence-based takeaway, weight loss, Mediterranean diet, regular exercise, diabetes and insulin resistance control, and cardiovascular risk reduction. These are strong evidence. Moderate evidence are these: coffee, omega-3, vitamin E, emerging evidence for the drugs. Bottom line, the scientific evidence shows the sustained weight loss, regular exercise, and Mediterranean diet remains the cornerstone for fatty liver treatment, which we kind of know. We discussed that throughout this document, that it is all lifestyle changes that are the mainstay treatment, and we can transform things. So regular exercise, weight loss, Mediterranean diet, these interventions can reduce the liver fat, inflammation, and in many cases can even reverse the fibrosis when implemented early and maintained. Recent advances in the medication like GLP-1, which is a Ozempic type of medication that offers additional options for selected patient, but lifestyle modification remains the foundation. So weight loss drugs are basically reducing your weight, remember, and they're indirectly modifying your insulin resistance and the body's fat, and then that they will reduce the fatty liver and maybe reverse it. So that's our fatty liver topic. So I'm ready for the questions.
Yes. Does the FibroScan test covered by OHIP?
Yes, good question. I think, good question. I think it's covered, but I think there might be some category of people who have to pay for it. So let's say if somebody does not have any liver changes and they still want to do FibroScan, there might be a charge for it.
I see. I see.
Yeah, but I had recently sent a young girl for FibroScan. I think she had to pay in 5 Fairview Mall for it. So I'll have to check on that one.
About how much is it? We have to pay?
I think she said $90 or something like that.
That's not bad.
Well, it wasn't over the top. Yeah.
Okay.
Yeah. Who's the...
Sorry.
Okay.
Yeah.
For the fatty liver, is it hereditary?
Fatty liver is not hereditary, but there could be some predisposition to it. So there might be some genetic factor that may promote the accumulation of fat on the liver. There is some evidence that it could run in families, that the way your body processes the fat and the way the liver processes the fat, you could be high risk if you have some genetic predisposition to it.
Depends on the lifestyles too, the
Depends on
eating
lifestyle.
habits.
There might be a small element of genetic factor too here. Yeah.
Thank you.
Yeah. Nicole?
Okay, for me, I wanted to know, because I'm big on supplements and I take all my omega-3, vitamin D, and all of that. Someone was saying to me that this is also putting stress on the liver. And I'm wondering that, so I'll take like the turmeric with the curcumin supplement as well. With the milk thistle, which is for the liver, like
Yeah.
you're trying to do a liver detox and stuff. But
Right.
I'm not certain how correct she is in terms of me taking all of those supplements and the impact it has on my liver.
So there are certain natural supplements that you have to be careful. Like ashwagandha is well known to cause liver toxicity if you take too much of it. I think milk thistle also you have to be careful with the quantity of it and what's your liver situation right now. So let's say if your liver is already showing that your liver enzyme is elevated, that means it's under stress. And if you give your liver these extras, which they go through the liver and the liver metabolizes those medications or drugs or supplements, then liver may not like that. So ashwagandha certainly is well known, it can even cause hepatotoxicity. So you have to be very careful with the dosages of ashwagandha and if you're mixing it with other medications, right? So there are certain medication which could put pressure on your liver, drugs like antifungals or amiodarons and stuff like that. So your liver is already maybe under a little bit of strain. And on top of that, if you take certain other things which put liver under strain, like ashwagandha, or I think milk thistle as well, but I need to check on that one, then you have to be careful. But if you take omega-3 in moderation, I don't think that would be a problem, or vitamins in the moderation.
Okay, thank you. Another question. What are some of the first symptoms for a person to have for you to recommend them to do a liver test? Or if I do like my annual checkup, does that include anything, part of it that is include testing the liver, any initial testing that is?
So all my annual blood tests I do for my patient, it does include liver enzyme. It includes ALT, AST, all those liver enzymes. They're part of bilirubin level, ALP. They are all part of the annual blood checkup. And I do it for everybody, including 30-year-old, because fatty liver starts very early on. It doesn't happen like later in the life. It happens very early on in your life. So if you do the blood test and you pick up slightly increased liver enzyme, then I do ultrasound scan. And the ultrasound scan often will tell you grade of fatty liver, grade 1, 2, 3, 4. I actually had recently a young girl, 22-year-old girl with severe fatty liver, clearly explained by her lifestyle. She was more obese and everything else. So I sent her for fibroscan, which showed she did have severe fatty liver, grade 3, but it shows that she has no fibrosis because her young age was almost giving her a little bit of immunity against it. So I told her, look, you're lucky that we got it, even though she's only 22, 23, but it's risky, right? If she's not going to reduce her weight, or if you don't put her on some weight loss medication, I think she already started a weight loss drug. So it's reversible now. But if you reach the stage of fibrosis, you're not reversible then.
Okay. Okay, then. Thank you.
Yeah. More questions? Has anybody had fatty liver on their ultrasound? I'm sure a lot of us. I actually had a very tiny blip of it, and then I repeated my ultrasound because I didn't like the idea. And then I repeated it, and the second scan didn't show it. But grade 1 is very common. You see that a lot of us, because the fat is accumulating on your visceral organ, like it's accumulating on lower abdomen and the other parts of the body. It's accumulating on your liver. We know this for sure. But because liver is so important and it does so many functions, we pick up through the liver enzyme checks. But that same fat on the pancreas is going to reduce your insulin secretion and so on. So
Okay. Okay, a person with normal ALT and AST doesn't mean that she's free of no indication of fibrosis.
I wouldn't, it's highly unlikely that you already reached that stage of fibrosis and your liver function is normal. I know in that stage it says you can still have fatty liver and normal liver enzyme. I think that can happen with fatty liver, but it will not happen with fibrosis.
I see.
Fibrosis almost means there's a damage to the liver that's happened, and it will show in the form of increased enzymes. Yeah.
Okay, thank you.
Yeah. But then there are other people, right? They have hepatitis. Like there's some people, they can have chronic hepatitis, which is just in the background condition, which is not making them ill or it's not making them sick or anything. They just have the background hepatitis. And on top of that, if they get fatty liver, so liver has a double strain. And then you may see that liver is struggling with that. Yeah, Maha?
Yeah, I just wanted to, can you hear me? Yeah, you can hear me. I just wanted to double check and ask, so if you have cysts in your liver, is that caused from the fat?
No.
No. Okay. So that's a different thing all on its own.
Yeah, cyst we see in our body, and there's no obvious explanation for that.
Okay.
We do the scans and you see kidney cyst and liver cyst quite commonly. It's not metabolic, really, no.
Okay.
It's just for some reason, like you get cyst on the skin, you get cyst on visceral organs, but it's not metabolic, no.
Okay, thank you.
Yeah. So, yeah, go ahead if any more questions. You know what? I love these sessions, and because I'm doing these sessions, I'm learning so much. Honestly, I love the process that, I'm gathering the information, and when I'm delivering it, I'm just almost reinforcing what I've learned. The only thing is summer is very busy. Kids are off school now, and my son has been booked for lots, so I've booked him a lot of these summer things, activities, and all that. So I'll take a summer break, and then in the fall, we'll resume everything again. Right? But honestly, I actually enjoyed this interaction a lot. I did. I have been actually. Yeah.
It's been absolutely amazing from my experience. Thank you so much for doing this for us. We're blessed. When I tell my friends, that's what my doctor is doing, they're like, oh my God, you're so lucky. And we are. I feel so blessed to have you being my doctor. And want to wish you a fantastic summer. Can't wait for the fall so we can start all over again.
We really appreciate it. Thank you.
Oh, my pleasure. And you know what? If I'm writing any blogs in between, I'll keep sending you those.
Please, yeah.
If you have my previous blog link, if you click on those, it will take you to my blog page and you will see what I'm doing, because I started to enjoy the process so much, learning and writing down. Yeah.
So you'll be sending us this one as well, right?
This one, you can actually, Penny, if you see the previous blog I sent to you, if you click on that.
Yeah.
From there, you go to my blog page, you'll see anything I'm writing.
Okay.
It gives you the list of all the blogs I've written, but I'll send this one too.
Thank you so much.
All right. Yeah. Yes, Jyoti?
Yeah, so same thing. Yes, we really enjoyed these sessions, and I like this color on you. It looks brilliant.
Thank you so much. Yeah, thanks a lot.
No, I think, yeah, you covered everything, and it's I was in teaching and I've retired now, but yeah, it's when you present something, you learn a lot. So it's great. All the work that you do. So just, I think near the end, there was a mention of vitamin E.
Mm-hmm.
Is that like a supplement?
Vitamin E, but there is a small evidence, right? It said there is a very small evidence for vitamin E and omega-3 as well. It's not a big evidence, but yeah, there's no harm in taking vitamin E because I think it's considered a bit of antioxidant too. So it can reduce that oxidative stress on the liver, or if your liver is inflamed already because of fat accumulation and so on, it might help with that.
Yeah. And the Mediterranean diet, yeah, great. But for vegetarians like myself, so no fish, but all the other things.
Yes, yeah. Everything else you can consume there, right? A lot of things there.
Yeah, yeah. Okay, thank you, and enjoy the summer.
Thank you. Thank you. Wish you all a very happy and enjoyable summer.
Thank you.
Right. I look forward to seeing you guys again.
Okay,
Thank you.
you too.
Thank you so much. Bye, everybody.
Bye.
Thank you. Thank you. Bye.
Thank you.
Bye.
Bye-bye. Bye, everyone.